Your presentation centers on lowering costs of care by improving outcomes through this genetic testing and personalized treatment. Can you discuss some of the cost concerns and tell us about the benefits that you've seen from such programs and how these benefits offset some of the costs?
Absolutely. So at the macro perspective, I think we're all aware of the trajectory with respect to rising healthcare costs today. Depending on what statistics you believe, we're paying between 18 and 20% of our GDP towards healthcare. By 2050, it's anticipated, if left unchecked, to balloon to about 40% of our GDP. That's simply unsustainable. And so some of the arguments that are used with respect to not activating genomic medicine are, number one, the actuarials aren't there to say it saves money. That's simply not the case. So we know that in monogenic disease, we can actually reduce the incidence of affected individuals through carrier testing, pre-implantation genetic diagnosis coupled with in vitro fertilization, first trimester testing. Carrier testing in the Ashkenazi Jewish population in New York State has shown that brilliantly, and there are economics surrounding that argument to show, yes, there is absolutely an actuarial basis for rolling out broad-based carrier testing. In the area of pharmacogenomics, there is simple arithmetic one can do around cost savings of implementing an upfront genetic test in high-risk patients, let's say the elderly, who go on drugs like warfarin and Plavix, to show that an upfront investment of a couple $100 in that subset sector of the population can save more than $10,000 with respect to readmission rates due to overdosing, for example, bleeding or clotting events. With respect to pre-symptomatic risk assessment for complex genetic disease, this is where the headroom is. So complex genetic disease equals chronic disease. This is really what is driving the cost curve in this country, and the rest of the world is following closely behind us in our footsteps. So prevention with respect to genetics, focused environmental risk mitigation will absolutely drive down the cost burden of those chronic diseases with respect to the actionable behaviors one can take around those. As you would imagine, the actuarials are a long time in coming. But we're now in 2011, we're 6-7 years out from that Navigenics experience. We're starting to see the early indications that genetic risk factor, delivering genetic risk factors along with focused exposure mitigation that is sustainable. It creates sustainable behavior change, and that results in both short-term and longer-term reductions in healthcare expenses. And so I know that was a long answer. But the key here is actuarials, showing that an upfront investment for a genetic test saves money, and we're finally getting that body of data. And so I anticipate this movement to balloon very quickly in the next 12 to 24 months.